Welcome everybody, welcome this evening. Really nice of you to join us. Lots and lots of people joining, and a few more people trickling in. Welcome to tonight's talk, where we've got some wonderful guests to talk about palliative care from Macmillan. And it's really nice that we can reach out to so many people across the county. And I can see already that we've got people from Mid-Notts up in Mansfield, or also in Nottingham, and that we can do that from the comfort of our own home, which is a really wonderful thing that we can do with Zoom and online education. So as you might have seen, and I've popped it in the chat in the waiting area, but I'm going to put it in the chat now, we've got a little bit of an opening activity while people filter in. So if you'd like to click on that link, go to menti.com, click on that link, or go to menti.com and put in the code, as you can see on the screen. Hi from Mid-Notts. Hi, Joe. Then we can, I just really want to know where people are from and just kind of want to know your backgrounds as well. It's all anonymous, so we can't trace it to anybody, but it's just really nice to know what sort of mix of people we have going on here. We've got a clinical nurse specialist, we've got a GP, and just to find out who we got in the room. Hi, wonderful. CNS Palliative Care Nurse Mid-Notts, welcome. Yeah, if you click on the link, then it will go up on the lovely words app. Word cloud there. Just to introduce myself, my name is James Waldron. I'm a GP working in Nottingham in Bulwell, and I also work with the Nottinghamshire Alliance Training Hub, which is here for all of your educational and support needs, and we go all across the county as well. So from Mid-Notts to the county, to the city as well. We've got lots and lots of CPD going on, and this is obviously tonight's, but we've got HIPS next week, and we've got further in our palliative care series. We've also got a conference coming up as well for GPs in a few weeks' time, so it'll be great to see some of you there. Brilliant. So we'll go back to our little they say we've got somebody from Southampton. That's actually my stomping ground. That was where I grew up. I'm not sure if you can tell. I don't think I've got a Southampton accent anymore, but maybe I do. Who knows? But we've got lots and lots of people joining us, and it's really great that we can reach out across the country. So the other thing I'd like to know from everybody, just while we're waiting for people to kind of access the talk today. So our next question is, what do you hope to gain from today's session? What is it that we might be able to fill you in on with respect to palliative care and cancer care, particularly from a Macmillan perspective? What is it that we could help support you with, help answer? And then our wonderful speakers will endeavour to answer some of those questions over the course of this evening session. This evening session is going to be around about an hour to an hour and a half, and we really encourage interaction. So it's lovely to see people posting in the chat. So keep your comments and your questions coming, and that way we can hear from you, can help shape today's session. So if you continue on, so it's on the same Mentimeter there. You can go to just type in some little things there. It'd be really nice to see what it is you hope to gain from today's session. Also to mention, today's talk is being recorded, so that others can benefit from it, and it will eventually make its way onto our YouTube channel. And there'll be lots and lots more things that to keep your eyes peeled. There's quite a lot in the backlog, COVID and whatnot. Let's delay that a little bit, but there's going to be loads and loads of great education from local consultants and local other specialists as well. So brilliant. So what Macmillan can offer to our patients? Fantastic. That's exactly we'll definitely be able to help you out with that today. How to best manage palliative care out of hours. Who is there to advise at 4 a.m. in the morning? Okay, hopefully you'll be able to answer some of those questions. Understand the role and what you understand about signposting, PTS community support. Great. Any other things that we might be able to help you out with today? Just pop it in. As I said, it's completely anonymous. So if there's any particular corners that you're interested in, please let us know. I will pop the link back in the chat there so you can click on it. But it's very easy to go to menti.com. Resources for patient and family. Yeah, I'm sure we can direct you towards some of those as well. Okay, well, so I'm just going to let people pop their thoughts in there. So continue to contribute over, and we will come back to this a little bit later. If you keep Menti on your phone, we are going to use that a little bit in today's talk. But without further ado, it gives me absolutely great pleasure to introduce our speakers today, Andrea Murphy, Sue Godber, and Emily Watson, who are, as you may know, from Macmillan. Andrea is an OT and a Macmillan OT at Sherwood Forest Hospitals, but works up in the north of the county in John Eastwood and Bassett Law. We also have Emily, who's with her background in psychology and works with Macmillan as an information support assistant, and Sue, who is a nurse with a history in colorectal and cancer care, but has been working with Macmillan. So I think came back out of retirement for the pandemic, but I'm sure she'll tell you all about herself. So I'll hand you over to them, and welcome Emily, Sue, and Andrea. Thanks so much for giving me time up this evening.
Well, thank you for joining us tonight. It's an absolute pleasure. We're going to sort of introduce ourselves very briefly again. I'll introduce myself sort of initially. So I'm Andrea, and I'm an occupational therapist by background. Historically, I've worked over here at Sherwood Forest, where I did the Macmillan occupational therapy role for about 10 years. But since then, I've worked across John Eastwood Hospice and Bassett Law Hospice as well. I do 3 days a week in this lead role here, but then also 2 days over at Bassett Law Hospice still. Emily, could I ask you to share the screen, please? So as you can see from this first slide, this is where we're actually based. We're actually based over at Kingsmill. We're in the Women and Children Centre at the moment. Not particularly ideally placed, but we sort of make the best of the space that we have available to us. So, if you do need to, signpost anybody to us, we are in the Women and Children Centre. So as we've already established, there's Sue, who works 3 days a week as the service lead, myself 2 days, and we're supported by Emily, who's our information and support service assistant, and Emily works across the 5 days. And our lead cancer nurse is Penny Tyndall. And Penny really helps us to shape our services in line with local and national strategy. So she is our sort of lead cancer nurse who helps manage the service too. So in terms of today's training event, what we're hoping to do is to answer some of the questions, that you've sort of identified yourself about, what resources are available and how we can support your patients. But really what we're wanting to do is to improve your awareness of the role of the Cancer Information and Support Service for people, that's really at any point across their cancer pathway. We also would like to improve the awareness for you on how to actually refer patients to our service, so then people can get access to it. We not only, support patients, but it's anybody affected by cancer. So it could be carers, it could be family, it could be staff members, it could be yourself, so anybody really affected by cancer. We also would like to explore the holistic needs assessment that we use and identify how we can support patients and carers using this tool and how it really supports that collaborative working across the different healthcare arenas. And then lastly, we're going to have a look at what's new, how we're recovering from COVID, and look at our vision as a service, in the future. So before we start, just to let you know, we have got a short presentation, but then there'll be plenty of room for questions as well. But first of all, James, we'd like to run the interactive poll that looks at, how confident people are in, what we already do, what people already know about our service. So if we can go over to you, James, that would be brilliant.
Right, no problem at all. So you can use, again, we're using Mentimeter a little bit today. So you can go to that code I put in before, go to menti.com and type in 72870252. And we just want to know about how confident you are in these particular domains. And then, as you might imagine, we're going to ask you again at the end and then see how you feel about it then. Hopefully we'll notice those numbers coming up. That's brilliant. What I will do is I'm going to pop that. I'm going to pop the code back in the chat for you, just so that you've got that to hand. There for you. So Got a bit of a spread here. Hopefully everybody can see that. Yeah, good job. So where the support, information and support service that Macmillan can offer my patients. So we've got kind of a bit of a spread there. A few people a little bit less confident, a few people a bit more confident. Understand what a holistic needs assessment is and how they are to support our patients. So again, we've got a really big spread. A couple of people that are very, very FA in that. And then lots of people that feel like they need quite some support. I can see how many people have answered here, so the number sort of ticks up at the bottom there. So it'd be really great to have everybody. We've got 29 people in today's talk, so it's really great turnout. So thank you all for coming this evening. So should we see if we can get to 10? 9? It's all anonymous. There's nothing will come back to you. So please be honest.
Felt that encouraged from.
Well, that's it. So as you guys can see there, we've got a bit of a hump in the middle. We've got a couple of people that are skewing the results slightly by being very, very confident, but most people are in sort of the mid sort of range. So I think we can make some improvement there. Super. Right, you can still contribute to this. It'll just be on in the background, and we'll go back to the main slides.
So this slide really sort of focuses upon partnership working, and first and foremost, we are a Sherwood Forest Hospital service, so we are funded by Sherwood Forest Hospitals, but we work in partnership with Macmillan. So all our funding does come from Sherwood Forest, but there is some additional funding from Macmillan, just really to help us with the development of the services and to support education and training. But the actual core of our services are Sherwood Forest Hospital services. And I think, a lot of people associate that we are Macmillan professionals, but we are Macmillan branded. But, in essence, we are employees of Sherwood Forest Hospitals. In being Sherwood Forest Hospitals, we do support the Sherwood Forest Hospitals population. So in the majority, that's Mansfield and Ashfield with Newark and Sherwood. But of course, being on the boundary, we also cross over into Derbyshire as well. So it's really important, that when we're signposting people, we've got quite a broad breadth of knowledge of what's available, not only in our local area, but moving across boundaries into Derbyshire. Macmillan, they provide very much evidence-based literature for patients, which is one of the key resources really that Macmillan provide for us as a service. And there's a whole host of different titles that are available in booklet form, very much about specific conditions, about symptoms, about practical issues, and also emotional issues, just to name a few. Importantly, which I think a lot of people don't realise, is Macmillan do provide some easy read titles for people who, maybe have got cognitive issues or perceptual issues, or children, or people with learning disabilities too. So, we can help support conversations around treatment, around end-of-life issues in particular, with easy read literature. There's also some literature available in a variety of languages. Usually they're available on the internet for us to print out. They're not already printed booklets, that, just to let you know that those are there. Macmillan also provide us with some grant monies to help support the development of the services. So, we have used Macmillan monies for providing digital display boards, to help promote the service. And also in future, we may be looking at things like swimming groups and things to support patients as well, which Macmillan hopefully will be able to provide us with some support. They also provide education for staff. So then we're at the top of our game, that we can support people using the most current evidence-based practices and information. But then also they do add as well to the strategic direction of our service. Each year we have a Macmillan service review, which really just makes sure that we're doing what we should be doing in terms of, what we're delivering, and that we're meeting the strategic objectives nationally and locally, and with regard to Macmillan cancer information. So that's just really to give you a picture. And of course, we don't just work alongside, Sherwood Forest and Macmillan. We also work in collaboration and, communicate with primary care, health and social care, community services, Notts Healthcare, the district nurses and, the hospices, the voluntary sectors, different charitable organisations, and things like Look Good, Feel Better, Beyond Diagnosis and Self-Help UK. Again, just to name a few of those organisations that we work with. So, like I say, we are based at Sherwood Forest, but in partnership with Macmillan, and of course collaborative working with the rest of the healthcare community. So what we'd like to talk to you about now is the holistic needs assessment that we use over here at Sherwood Forest Hospitals, and it is a Macmillan holistic needs assessment. There's a lot of different tools around, particularly in sort of palliative care. We may use the IPOS, which is a similar type of assessment. But over here at Sherwood Forest, we use the holistic needs assessment. And that's something that we do communicate out to GPs as well with the treatment plan. So can I just ask, I don't know whether you want to pop it in in the chat box, but how familiar are you with the holistic needs assessment? Did we cover that, James, with the...
No, so we did. We put that in. So people are around about 6.3, I think it was by the end of it. Okay. A few people are not at all.
So that's interesting. The fact that some people, like say, are very aware of it, and others haven't got a lot of information. So we'll go through that again. But really, it's just a tool that we use to ensure that we provide the right support at the right time, for people. And certainly in terms of, the cancer information and support, timing is very much of the essence, and it's essential that we get this timing right. We do provide a whole host of information for people at diagnosis, but it's about not bombarding people with too much information. So it's really important that, we get the level of information right for those people. Too much information can be overwhelming, too little information, the people can feel alone. So it's really important that as healthcare professionals, we get that right. And I think the holistic needs assessment really tries to, sort of focus where information is needed. So then we can target that information in a way that's suited to the patient. We support clinics, like I say, with the information for patients. So could I have the other slide now, please, Emily? So looking at what the holistic needs assessment is, it is part of the personalised care agenda, which really we're ensuring that care is suited to the individual and it's led by them. The patient is always in the centre of the assessment. And it's an assessment, and it's about a discussion, it's about the conversation that a patient has with someone from the healthcare team. Now that can be anybody they choose. It may be the CNS, it may be us in the cancer information pod, it may be, the consultant. It's anybody really who that patient feels that they're comfortable to talk to. And really it's an opportunity for them to talk about any of their needs or any of their concerns. But also I strongly feel that it should be a conversation about what's going well for the patient as well, not just about, concerns. It's about identifying what's going well, what's not going so well, and looking at their needs and concerns. And finally, once we've looked at those, and we'll go through this in a little bit more detail later, is to look at how we agree the plan of care and what support that patient needs. And interestingly, the holistic needs assessment can be made available to patients at any stage of their cancer pathway. So very often, at point of diagnosis or there around, some people may not feel ready to, identify their needs and concerns at this point, but certainly, any time through the pathway. So it may be as people go into treatment, it may be mid-treatment, it may be end of treatment, or even, as people are coming out into survivorship, hopefully, where it supports the risk stratified follow-up. As people enter into palliative care as well, it can also be a tool. So it's a tool really that people are aware that it's there. They're regularly asked whether they want to complete it. But also when people come to us for information, very often they'll say, I just don't know where to start. I'm lost in amongst it all. So we'll pull out the holistic needs assessment at that point and offer it to them, because it's just really something that helps formulate people's thoughts and their ideas, and helps them identify, you know, that level of support and information that they're needing. Okay. So just another question. In terms of the holistic needs assessment, before we reveal all, what do people think are the key areas of the holistic needs assessment? Yep, so we've got financial concerns, mental health assessment, physical needs. That's brilliant.
There's the same links before, guys, so you can go on Mentimeter and just contribute to this one.
Medication review. Yep.
Somebody in the chat's put care and needs.
Yes. Yep. Social, spiritual, fantastic. Yep. Family support, brilliant. So yeah, so you've got a good idea there of sort of the holistic needs assessment, and I think they are very much sort of subjects of any of the holistic assessments that are available. So yeah, Emily, do you want to just, let's reveal the answers? So there we have it. So always the patient in the centre, so the person's needs and concerns. So the holistic needs assessment looks at sort of physical symptoms, and this is a checklist. And again, this will be highlighted more later. So it may look at different symptoms, things like shortness of breath, pain, fatigue, memory issues. The emotional, it may look at whether people are angry or sad or worried. Practical, money and finance is a huge sort of issue, particularly in, you know, sort of the more deprived areas like, you know, Mansfield and surrounding areas. Also sort of things like how to look after pets and doing the housework and the laundry. Family relationships, you know, how does the cancer affect the relationships? Spiritual, so that's very much about faith and spirituality, but also that broader term of spirituality, of who you are and what gives you meaning and what gives you purpose. So it also identifies issues around there. And then specifically, we've got information and support. You know, do they have all the information that somebody needs in terms of things like exercise and activity, or even legal advice? So it just really gives us a very clear picture of what that person's, how they prioritise their needs at that moment in time. And of course, we know that those prioritisations can shift throughout the cancer journey, and even, you know, from day to day. So that's why it's really important that the holistic needs assessment is available at any point, you know, that a patient feels as though they need it. So I think we're over to Emily now.
Yes, so I'm going to kind of talk through the holistic needs assessment and link it to kind of exposing our service a bit more. So we're going to look at a few case studies of one patient and link it to how our service can support this patient. So you'll also get a bit more of an understanding of the holistic needs assessments, but also kind of what our service can offer and why patients might come and visit us, what they might get from visiting us. So basically, at a holistic needs assessment, it's either done over the phone or face-to-face. At the moment, a lot of them are done over the phone because patients aren't coming into hospital as much. It's a 72-item checklist with all the possible worries or concerns you could probably think of. And all they have to do is check the one that is that they relate to. So they can check as many or as few as they want to. And then if they do check one, they have to rate it out of 10. So if they rate it as a 1, it's kind of like, this is worrying me a little bit, but it's not really a massive issue. And if they rate it as a 10, it's like, this is kind of taking over all of my thoughts at the moment. I can't carry on my life because it's getting in the way, kind of thing. And then they have the opportunity to discuss the answers with their healthcare professional. So like Andrea said, it could be the nurse specialist, it could be one of us guys, it could be one of their support workers. A lot of the time it's done by the nurse specialists and the support workers, but we do try and get involved where we can. And it's kind of like a collaborative thing between the healthcare professional and the patient. So we create a care plan of everything we've discussed. So the patient has a point of reference and the healthcare professionals have a point of reference. And also we do send these out to the GPs. I don't know if anyone's kind of seen them or not, but we will touch on that a little bit later. So I've got a case study of a lady who's completely made up. She's not based on anyone real at all. So it's Sally Salt. She's a 34-year-old lady who's been experiencing some unusual symptoms. She's noticed some blood in her stools as well as some weight loss, and she's feeling extremely tired. She lives at home with her 2 children, aged 3 and 8, and her husband. So in order to help you understand kind of the support that is available to Sally, we've got a holistic needs assessment done at 3 different points of her kind of cancer pathway, just to kind of identify what support is available at each stage and how it can differ from diagnosis to treatment to end of treatment, because people's priorities change during the pathway and what they're worried about can change a lot as well. So this is what a holistic needs assessment checklist looks like. So this is what they'll have in front of them. Or if they do it electronically, it's kind of a bit more interactive and you tap through it and things. So this is an example of a checklist that imaginary Sally has completed when she's just been diagnosed. So we're imagining she's just been given the news that she's got a colorectal cancer, and she's come into clinic to meet with her consultant to discuss her treatment options. The treatment she's been offered is surgery followed by chemotherapy, and it has got a curative intent. Following the appointment, she then has been taken into a quiet room and offered a holistic needs assessment. And this just shows you what she's scored for the different points that she's ticked. So we're wondering whether anybody had any ideas of, so if, for example, if Sally presented with you guys as one of your patients, if you had any ideas of where you might signpost her to, what support you might offer to her, where you might send her in the direction of. Were we going to do a little cloud for this? If anybody wants to log back on and just kind of say, I'll just have a look. I don't know how, if people like seeing what their scores are, you might have forgotten already.
Yeah, that's a tricky one. Okay, why don't we read out the ones that, just so to remind people.
Yeah, I need to just, you can't see my screen, can you?
I've got it up here. So she's got 6 for tired, exhausted and fatigued, 5 for pain and discomfort, 8 for sleep problems, 7 for work and education, 10 for money and finance, emotional concerns, 10 for uncertainty, 8 for unable to express feelings, 8 for thinking about the future, 5 anger and frustration, 9 sadness and depression, 10 worry, fear, anxiety, and then family relationships, partners and children.
Yeah, so there's quite a few about the emotional concerns. So obviously, sending people in the direction of clinical psychology, counselling, IAP services. So I guess if Sally presented as one of your patients with all of these concerns, then she'd probably be sent in the right direction.
And we've got the GP as well, for the pain issues.
Mm-hmm.
And the other physical.
Okay, so these are some of the examples of what we could offer Sally, like what kind of things we would consider if she presented to us with this checklist. So for the financial concerns, we have got the Nottinghamshire MacMillan Money and Work Service. So these guys can do a full financial review and see that she's getting all of the benefits and things that she's entitled to. They do work kind of similarly to the DWP, but they are like a service that's specific to Nottinghamshire and their Macmillan service. They can also help people fill out the applications, because if you've ever seen a PIP application, that can be so overwhelming for a patient, especially at this point of their journey. So they can help you with like what kind of answers, how to word your answers, and what kind of things to put down. The booklet in the middle of the screen, so that's a booklet about managing the symptoms of cancer, but we've got hundreds of booklets like this with all different information, like the one across that's talking to children and teenagers. So we've got so many of these booklets on so many different topics that we can offer patients. A lot of patients come and take about 10 at a time and then come back for more. So they like to read their way through it. She had worries about her wills and legal advice. So Macmillan do offer a free will writing service. And to sign up, it's super easy. You just log on to the, well, you don't have to log on. You just go onto the Macmillan website, search for free wills and fill in a few details and get put in touch with a solicitor. We would consider doing a PHQ-9 and GAD-7 measurement for depression and anxiety because well, first of all, that's the requirements for our clinical psychology pathway, and they can triage. So they will either see patients themselves or they'll refer people across to like Insight Healthcare. Maybe that we direct people in the direction of the GP for mental health services as well. And then also where she had concerns about telling her children about her diagnosis. So we've got loads of different children's storybooks in the Macmillan Centre, and these kind of are used to help children understand illness. They're all looking at things like love lasting forever. Some of them don't even cover illness and disease, but they look at kind of the relationship between parents and children and how it will last and things like that. So they're a really useful tool as well. So the second EHNA to look at is during the treatment. So you can see that she's got a few more physical concerns as she's starting to get side effects from the treatment. Her emotional concerns have changed slightly. She's starting to feel a bit more lonely and isolated, and she's a lot more concerned about her independence. And then in terms of information needs, she is wanting information on complementary therapies and also what support groups may be available to her. So the same question again, looking at these concerns, has anybody got any different ideas of where they might signpost Sally to?
Might just pop it in the chat just
yeah, no, that's fine.
Otherwise I have to read them back out again.
Yeah.
Got GP, we've got social care being suggested. Got a lot of physical symptoms now, hasn't she?
So at this stage, obviously if she was presenting with quite a lot of physical symptoms and this care plan was being done by kind of myself or a support worker, we would probably refer them to their CNS to deal with a lot of these symptoms. And in turn, they might refer the patient over to the GP for pain management and things. But yeah, I'll kind of move to the next slide and show you what kind of things that we would consider. So she had concerns with diarrhea, which can be managed with medication, but also as a bit of a kind of support for that, we do have a Macmillan toilet card, which is easily downloaded from the Macmillan website. And it's basically for people to take into kind of shops and pubs where you have to buy a drink to use the toilet and things. And you can just show it to a member of staff and it just might help you to be able to access a toilet quickly and efficiently when you're in need. We do have a complementary therapist at the hospital. So she does things like massage, Reiki, aromatherapy, reflexology, which can be really good for patients who are on treatment. She had problems with her appearance. So we do have, like Andrea said, we work with Look Good, Feel Better to offer pampering makeup workshops for ladies. It gives you all tips on things like hair loss, how to put your makeup on if you're losing eyelashes and eyebrows from treatment. And it's just a really uplifting afternoon for the ladies. They can also access wig vouchers from us up to £125 to purchase a wig from the local wig providers. And in terms of kind of support groups and things like that, there's a few local support groups that I've just written here in the bubble. So ABC, Impact, and the Walking Group. And then there's also a whole range of Macmillan online communities as well. So yeah, I feel like I'm throwing a lot of information out there, but we're just trying to highlight just how much support is available to the patients if they know about it. Because sometimes you'll get a patient come along and say, I didn't know any of this existed, and a lot of patients still think that Macmillan means that you're dying, and oh, I don't want to deal with Macmillan because I'm not end of life, but actually it's not that at all. So as much as Macmillan nurses do deal with the kind of palliative care, they also deal with people at every stage of the cancer pathway as well.
Emily, can I just sort of intersect?
Yeah.
Charlotte has just been popping in about palliative care and the role of the hospice, particularly sort of over at John Eastwood in this area. And certainly, we do recognise that even when people are having treatment, if they're having difficulty with their symptoms, then palliative care, and the hospice does fit with, people having active treatment as well as sort of purely sort of palliation. So it's just really important, to say that we do, sort of link in with the hospice when it's appropriate, and we do identify that, when people, are having, the chemotherapy, radiotherapy, even if it's supposedly, to a certain degree curative, then there's, if people are experiencing particular symptoms like pain, then it's about sort of cross-working between the services, but giving a clear explanation and reassurance to the patients at that point as to why they're actually being referred, with their permission, over to sort of hospice services. So, that's something else to sort of think about.
And I think as well, linking to that, the hospice, especially John Eastwood, have been trying to get patients to access their services long before they become palliative. They've got singing groups, coffee mornings, and their aim is to really try and get patients engaged with their services. So even if it's years and years down the line, they need to access hospice support, they're already kind of familiar with what it's like, and they've got that kind of understanding of it, rather than kind of going into the unknown at the stage when they have to almost.
Yeah.
So yeah, the last part of the EHNA bit here is this checklist here, which is has been completed after Sally's finished all of her treatment. So she's very tired. She started to have a few concerns about kind of her relationship with her partner, some feelings of uncertainty, thinking quite a lot about the future now that she's kind of got the headspace to do so. And then her information needs are around exercise, possibly getting back into fitness and planning for her future priorities. So, I mean, anyone got any ideas they want to pop in the chat, or shall I just kind of, I feel like we've exhausted a lot of the ideas right now, so I can't actually see the chat, so I'm not really sure.
So yeah, it would be great if people put a few ideas in the chat. I will read them out as they come in. So health and well-being coaches, perhaps for the information and support aspect, the exercise and activity aspect. This lady seems to have quite a lot of emotional type issues at the moment, isn't it? And
physio, occupational therapy.
Somebody's wondering about, is there a booklet for intimate relationship issues?
There is a relationship for cancer and your sex life, yeah.
Physiotherapist, could they be helpful?
Yes, yeah.
And an occupational therapist.
Why the OT
Send you Andrea's number.
That's it.
Give you your personal number, Andrea.
Peer support groups.
Yeah, really important.
Yeah, we've got those. Yeah.
Fab. So some of the things that we might suggest, there's the booklet that I mentioned. We have a couple of exercise groups that we kind of recommend people onto. So the Spring into Action course is ran at Kingsmill Hospital by the oncology therapy team. It's like gentle exercises. They cover like a different exercise each week. So there'll be like banded exercises, Tai Chi, yoga, and it's just easing people back into activity. It's also accompanied by an information session at the end of the activity. So they'll have information on diet, finance, talks from the psychology team. So it's a really like fantastic program. And then there's the Cancer and Rehabilitation Exercise Programme, which I think is that partnership with Notts County Football Association or somebody like that. And that's quite similar to Spring into Action. The two kind of complement each other. Gentle returning to exercise, supported environment. And then we've also got a Macmillan Hope course, which we're actually just starting back up next week. It's a 6-week kind of self-management program that covers all different topics such as fatigue, kind of goal setting. It's aimed at the people who have finished treatment or about to finish treatment and kind of want to get back into living, basically. So that's a really great course that hopefully will be well attended next week.
I think very often, Emily, people tend to feel a little bit sort of abandoned at the end of the treatment. So this is a really nice way of giving them the support to move into that sort of survivorship and giving them the tools to maybe overcome some of their sort of reflective concerns about what they've actually been through during the treatment. So, like I say, it is really good in looking at sort of goal setting, looking at mindfulness and different sort of anxiety management techniques, which, I think when people are going through the treatment, they're very much on an automatic pilot, but when they've finished the treatment, that's where they actually sit and think, wow, what have I been through and how do I move forward?
Yeah, definitely. When they stop having regular appointments, they kind of lose their safety net, and they're just kind of chucked back into the world all of a sudden one day, and it can be very daunting. We get a lot of patients who say like, I don't know what to do now, I've not got any appointments, and I think that's where the Hope course is probably really useful, like you say, Andrea.
And it's available nationally.
Yeah. And online as well.
Yeah.
So I won't kind of touch on every single thing on this slide, but these are just some other support offerings that we have available to us for patients. So there's things like the swimming group, information and support. We can help people with blue badge applications, and if they have a DS 1500, then they just automatically get a fast track blue badge. The Cinnamon Trust helps people walk their pets if they're like unwell or unable to, or in hospital. We kind of have the Horses Help with Healing, kind of horse therapy, stepping stones bereavement support. So even for, as you say, as you said at the beginning, Andrea, like family, we don't just deal with patients, we deal with everybody. Even after, say, the patient has passed away, we would still be there to support the family. We have a mindfulness course run by the psychology team, and under the physical concerns, you can see all the different kind of professionals that we refer to. So like if people are still experiencing side effects from chemotherapy and radiotherapy kind of 6 months after treatment, then we can refer them to the late effects clinic over at Nottingham. So yeah, there's kind of a whole host of different support offerings on this slide. And then just to kind of round up this section is just an example of a care plan, which is what we do send out to the GPs. So if you've ever seen this before, then great. If not, this is what it looks like. We just kind of, it goes through all the concerns they've ticked, and we just write a little bit about what that concern means to the patient, so how they've explained it, how they interpret it, and then any comments on like what we've suggested that they do. So we, for example, for the money and finance, we've recommended a referral to the money and work team. You can kind of, it's quite self-explanatory, but it's just there to document the conversation, and also so patients can remember the conversation a lot of the time, because they get so much information. They might forget what we've talked about. And if we've said, oh, we're referring you to this team, and then a week later, some random person calls them and they've got no idea who it is, they could think, actually, I'll just check my care plan because I'm sure we talked about that before. So that's what it looks like. And I think it might be time for me to pass over the microphone. Yes, it is. So that's a nice little whistle-stop tour on the EHNA and the care plan. If you do have kind of any questions on any of that, I think we're going to cover them at the end of the session. So hang on to those and I'll pass you over to Sue. Is it Sue next?
Yeah, can I just also say that, you know, the care plan, it's great for sort of communicating with other healthcare professionals as well, because if patients have that handheld, then they can bring it to the GP, they can show it to the district nurse or the palliative care nurse, you know, sort of say, actually, this is what I've already discussed. So it sort of avoids that duplication, but also it can trigger some of those conversations that may be, you know, with regard to the children, well, how are you managing with that concern now, you know, and it just provides that sort of prompt for other healthcare professionals just to check in with people, just to make sure that they're, you know, continuing to get that level of support that perhaps they've identified that they need.
Thanks, Andrea. Just before I go on to the next section, can you put into the chat how many of the GPs have actually seen a care plan? Because a lot of these care plans are going out into the community, into primary care, but we get very little feedback. So it'd be interesting just to know how many of the GPs online actually have seen some of these care plans. So I'm going to cover what we're doing next, the future developments in our service. You've heard a lot about what we can refer to in the community, and the pandemic unfortunately has impacted greatly on our service, but we're just now starting to recover with social distancing opening up. Our service has always been there as a face-to-face when a lot of the support services have actually closed down over the last 2 years, but we've managed to socially distance and still have those difficult conversations with people. So a lot of our events and workshops were postponed, but we've now opened up the majority of those. So I'm just going to go a quick overview of what we can offer as a face-to-face and what we're planning to do in the future. And just as a heads up, I will be asking you at the end what it is you'd like us to maybe start to develop, because it's all right, listen, this is what we're going to do, but actually we need to know what the primary care trusts are looking for, really, and just to see if we can help promote it or even help to start new groups and things. So you've heard a lot about the HOPE course, which is helping overcome problems effectively. And as Emily explained, it's a 6-week course, which is what we would class as a scripted course. So we're very tight guidelines as to how we deliver that course. And it's all designed to develop upward spirals of positivity. So people coming in post-treatment are looking for that hope, looking for getting to a bit of normality. And I'm really pleased to say that this course will be going out next week, and hopefully we should have some future dates for the course. We have got very few people that are qualified to deliver this. So if there are anybody out there who wants to do some more training, I'm sure you could always do that for your profiles. We'd like to hear from you and see if we can incorporate you into our numbers and to deliver more courses, because at the beginning of the course, people do a Wordle, very much like you've done tonight. And it's shown that the positive feeling at the end of the course has actually greatly developed their sense of well-being. It covers, as Emily said, smarter goal setting, mindfulness, fatigue, increasing your activity and positive thinking. A lot of those things that will help their well-being and hopefully reduce the amount of time that they're turning up in the GP surgery with things that are bothering them, that actually it gives them the tools to sort out themselves. We're also, sorry, my computer's just about to restart. I don't want to do that. Emily's organised a patient walking group, which is new to the trust and to our service. It involves twice monthly, so the second and fourth Tuesdays of the month. We go round the Kingsmill Reservoir with a group of patients. It's open to all patients, and it is expanding rapidly. We're there from 1 till 3, and then we go for a socialising drink afterwards and just a chat with the patients. That started prior to Christmas, and we've now got about 10 regular people coming every time, and it's great to make those connections with people, because I think you all agree that socializing in a community increases your life expectancy by about 7 years. So it's good that that will be a quality amount of life as well, because they'll be fitter and much more positive by going out and doing some activity. We have, prior to the pandemic, we used to have the cancer information and support event, and I'm not sure if any of your patients had actually accessed that. It was a pre-habilitation course where we had input from clinical psychology, dietitians, CNS teams were there to do the EHNAs. The physio came along from Spring Into Action. The voluntary services from Beyond Diagnosis and the Money and Works team all came together as a marketplace where we could all talk to the patients and present our wares. This is something we want to get back to, and we've been a little bit limited by the space that we could utilise because of the vaccine centre over at Kingsmill, which has now moved, and hopefully we're looking at around about July time, August, to get that event back up and running. And it would be great to collaborate with the primary care and maybe make like for like over at Newark as well, because we're very aware that we're very Mansfield centric, and we want to go out into the community to try and take these events into the community rather than just in the hospital. We want to get out nearer to the patients that we're actually looking after. So if you've got any spaces that we could use, that we could come out and do some events with the teams out in the community, that would be brilliant. Emily mentioned the Look Good, Feel Better workshops. We've started delivering those face to face now, although they are still available online as a virtual workshop. They run once a month on the third Tuesday of the month, and it's for a 2-hour session. There is a limited amount of volunteers to deliver the beauty sessions, and if you know any beauticians out there, we're more than happy to incorporate those into the workshop once initial training's been done. But certainly at the moment, our numbers are overwhelming of the people that want to come along to those workshops, because they help you feel more positive. As Emily expressed, if you're losing hair, eyebrows, eyelashes, there's nothing worse than trying to put your face forward positively in that situation. So it just helps to promote how people look forward to things. We've got a new app which is being launched on Monday, hopefully all being well. We had a few technical difficulties and a few problems with COVID. It's a new, so it's called My Health Boost app. And it's going to be available to download from the App Store. And basically it's it shows you all of the services that our team offers, as well as the wider community. So if you have anything, we saw in the chat about a palliative coffee morning, please do send us things like that in. We can promote it on the app, and it has a positive message that goes out to everybody who downloads it. So any changes in venues we can put on the app and patients will see it. And it's designed to have all the links to all our services that we have. So hopefully, if every patient that we see downloads the app, they'll have everything that we have to offer in the palm of the hand, 24 hours a day, 7 days a week. And it will save them contacting some of the health professionals when they can actually be empowered themselves to actually find that information. There's always a background running on that app, and it will tell us what information people are looking at, so we can start directing our services to where people need it the most. So as I say, that will come out on Monday, all being well. So we'll advertise that once it's launched properly, and you'll be able to download it on your own mobile, because there'll be a site on there as well for professionals. So if you're in with a patient and you're not sure what to do, you can go onto the app and have a look and see where to transfer the care to, where to refer to, and hopefully it'll help your job as well. We have a Twitter site which we set up, which advertises all our wares as well, and it tells everybody the dates that we're doing things like the walking groups and the Look Good Feel Better. So if you have both of those apps, you'll know exactly what we're doing and when we're doing it. So I know that was a bit rushed. I was a little bit cautious about the time. We're running on a little bit. So from your point of view, is there anything that I have said that you'd like to explore more, or anything that you feel we've missed out that we would help you to help your patients?
Brilliant, thank you. No, you ended dead on time, in fact. Exactly on that.
Thank you.
We're doing rather well there. I'll just leave that up for a second, and I'll just minimize the screen just a sec. Yeah, but now is absolutely the time for you to ask your questions if you've got any questions, and certainly use our experts while we have them here today. And hopefully people will enjoy the question and answer, and have some questions to ask. We've got a few. A few's come through as we've gone through, but now's your chance. Pop it in the chat, and we'll make sure we ask our experts here. Right, so I've got a fairly straightforward one. Actually, the most recent one that's been asked: how do we refer to MacMillan team from GP? How do we actually get the patient from us to you?
Right, so I think you can see on screen our contact details. When we say Macmillan, we have to be very clear that you mean the information support team, because I saw some comments in chat about, how do we get hold of you at 4 o'clock in the morning? Our service is only Monday to Friday, 8:30 till 4 p.m, except bank holidays, because we're not that dedicated. No, I'm only joking. So you can get hold of us through the switchboard if you're internal at the hospital, which is extension 6499. Or we have a mobile number, which is 07920 361 960, or we have a shared email as well. So if you email that shared email, you'll get all of us. Ideally, we prefer you to use that, because as Andrew explained, I work 2 days, Andrea works 3 days, and Emily works across the board. So if you emailing directly to one of us on our personal email, you may well miss out on the information that you need. So I strongly suggest you always use the shared email box, because that way you'll always get an answer.
Brilliant.
So we don't particularly want to go down the route of another referral form. Very often it is about sort of suggesting to patients to get in contact with us, and we have certainly within the Mansfield, Ashfield and Newark and Sherwood regions, we have posted out to all the GP centre managers this questions about cancer drop-in service with all our information on, so you can give that to a patient, and the patient can phone us directly, or if you feel as though they need us to contact them, then all you need to do is just email us their name, telephone number, maybe a date of birth, so we've got some identifier with just a brief, can you contact this patient regarding, and we'll certainly make contact with them. So it's hopefully not too much of a laborious process. And
do you know, is that the case across in other areas as well, or is it so for instance in NUH?
Yeah. I mean, on the slide in front of you, we have put the Nottingham Centre's telephone number on. But yes, I don't think a lot of the centres actually use referral forms. It is very much, that sort of informal, sort of contact, because we don't actually hold patient notes. So we will communicate with you using the holistic needs assessment, or we'll email people directly. But although we are healthcare professionals, we are classed as, sort of almost admin and patient-facing admin.
We are admin, yeah.
Yeah. So
certainly, I think it's
we have limited access to medical information. So we try not to make it too formal with regard to formal referrals.
I think it breaks down a lot of barriers when you can just pick up the phone and talk to somebody, rather than having to fill out a form, because time is precious, and as you said earlier, 7 minutes a patient, you need a quick answer there and then, really, don't you?
So if anybody would like any more of the little leaflets there, or any contact cards that they give out to patients, then just email us and we can certainly send you some more out.
Brilliant, it's great to know. Jigisha, did you want to say something there? I've noticed I've unmuted to.
Oh, no, thank you.
No worries.
Really helpful. Like, I'm from West Midlands Deanery, so it might be similar process, looks like. Yeah.
Super, thank you. Well, I had a few other questions here. So one of which is about, obviously you've got some really great services there with the app coming up and all of these groups. Do you know if that's pretty equitable across the country, or are you, is it all sort of like within your areas, for Newark and Sherwood? Do you as a little team forward that, or is it is this sort of plans across the country?
Certainly, there's a lot of the things like hope, look good, feel better. They're nationally, they're very well known, run by charities, but a lot depends on the training. So some areas will already be doing a lot of hope workshops, others not so much because of the availability. Things like the app and the walking groups, they tend to be homegrown, and certainly we're one of the first trusts in the country to launch the electronic app that can be downloaded for patients. And that's my little baby, so I'm very pleased we've actually launched that off with Macmillan. We're very good and help purchase the licenses for that. So I'm hoping it will benefit both patients as well as professionals, because I think a lot of this is learning who to contact and when, and the whole point about the app is that it's at your fingertips. 95% of people now have a smart device, whether that's iPad, phone, computer, and it can be downloaded to all of those on Android as well as iPhone. So I'm very hopeful that we'll get that out and the information that we can help with people very quickly.
We do have regular meetings with the other centres, sort of locally, into Kettering and places. So what we tend to do is share areas of best practice. So if the app is successful in our area, then obviously we'll be sort of shouting about it at their centres as well. So hopefully it may be something that is rolled out a little bit sort of further afield, but it does depend upon finances. And I suppose to a certain degree we are very much a pilot site, but certainly, if it's really working for us, then we'll be sort of talking about it, and hopefully other centres will prick up and go, this sounds like a good idea. So, at some point things start, as that small seed, and then hopefully it may flourish and become more of a standard, especially as we move forward with the digital agendas.
Brilliant. I think the digital age has definitely helped us reach people, and I think that being aware of the services to be able to refer to and knowing how is a big step in the way. Because I certainly think that no matter where we are in the country, it's given us energy to go and find our local Macmillan service. I suppose I was wondering a little bit, sort of with a bit of a GP and commissioning type hat on. I don't mean commissioning, but you never know these things in the future. How are most Macmillan services funded like you are? So funded by the hospital. Is that the case in NUH, for instance?
It is.
My post. Sorry, Andrew, you go.
I was just going to say a lot of the services are initially sort of supported by Macmillan as what we call pump primed. And I know that when the Macmillan pod arrived at Kingsmill, it must have been probably about 20 years ago, it was very much commissioned and pump primed by Macmillan for the first couple of years. And then once the service is established and, it's proven its worth, then it's usually the local health trust that would then pick up that funding. And I'm not quite sure where the money's come from for that, but it goes into the funding stream somewhere. That's my interpretation anyway. Sue, is that?
Well, I was my post originally 22 years ago as a colorectal nurse was pump primed, and they give you 3 years worth of wages on the understanding that post will then be taken up by the trust afterwards. So it is a way of establishing services very quickly. And in that respect, Macmillan has been fundamental in providing the service that we have now, and certainly as we expand, it is a business case to the trust that we have to find additional funding to that. But I think once you've created a need, then you can certainly expand on it quite easily because the need is there.
Some of the other healthcare professionals that haven't historically been Macmillan, they can apply to be adopted by Macmillan as well. So again, they would be funded by the sort of acute trust or the employing trust, and then Macmillan come in and they're adopted. So then they get access to the additional training, so then, the cancer professionals have access to that additional education and support, and also, the service type grants as well.
That's
I
good
think
to
there
hear.
is a lot of sort of misconception around what Macmillan is, especially with their sort of TV advertising that we're there every step of the way and things, so there is some misconception really around, that a lot of people in the community do believe that we're actually employed by Macmillan.
Yeah, I think that's probably a common misconception, because until today's talk, that was my conception. So, but I know that obviously there are charitable aspects to this as well, and we know that with the pandemic, charities have really suffered and have gone through very hard times. And you've mentioned a couple of things here, which I'd love. I would really like if some people within our group here were able to help you out. You've mentioned things about spaces where you could run groups out of, and then beauticians. And what other ways can we help? Can we, as health professionals and as just, I suppose, general members of the community, how can we help you?
I think certainly if you do, if you know of any local support groups that are out there that we've maybe missed, if you could be our eyes out in the community and actually let us know what's going on, then that would be absolutely brilliant. So then we know that, the breadth of knowledge is thorough of what's out there in the community. So yeah, if any of you want to let us know what services, you're involved in, or, the patient access that we've perhaps not talked about, then that would be fabulous in terms of, sort of expanding our database of service, because how do we know if we don't know what's available? So we are always trying to find new things, because especially after COVID, new things are cropping up in terms of support, whereas some of the supports that we have historically perhaps referred into, they may have not survived. So we're in a very different sort of climate and community to what was. So certainly, if it's that availability for that two-way communication, then that would be brilliant.
Yeah, certainly. Well, I think that we're more than happy. I think as GPs, I suspect I speak for everybody, that we're very happy to receive information and have those conversations with yourselves. And particularly if you've got areas of things that you need, like, you know, beauticians, I had no idea. I mean, not that I know any beauticians, but I'm sure some of us do. And then actually, I think there are ways of us getting those messages out there and helping promote the work that you do, and raising awareness among our colleagues. So certainly something that we should talk about after today's teaching. Yeah, and we've got some just a lovely comment here about how much we've been informed today, so thank you so much for that. If anybody else has got any other questions, please pop them in. We're going to go for another couple of minutes, I think, but if you do have to rush off, please fill in the feedback form. It's very, very helpful if you can. Right, what else is it? I suppose one thing that I was quite interested in is what do you think in primary care, you know, sort of in GP practices, what do you think we could be doing better for our patients with, you know, that require Macmillan support? What do you think that we could be doing better? If there was one or two things.
Personally, I mean, looking at the chat, I think one of the biggest things you can tell your patients is that if you're going to refer to Macmillan, that they're aware that they're going to the palliative care team, because Macmillan covers a huge breadth and people have expectations. I think the palliative care team really struggle when they're expected to fill that void that Macmillan fills. So if you're going to do anything, please refer to the palliative care team as palliative care and not just Macmillan, because a lot of the services around this area aren't, although they're palliative care, they're not Macmillan supported. And I've seen some of the chat online, and I think that would be helpful to them, certainly, and to us. Yes, we're working partnership with Macmillan, but we're profoundly a Sherwood Forest Hospitals Trust service.
Yeah, I think it's really helpful, and it sounds as if something again we could do, and I was suggested by Dr. Bloor in the comments here, that perhaps you might do a PLT, and so you can sort of get up in front of some other people in knots, and maybe get your colleagues down our end to again just really get the message out, because we've reached 30 people today, but it'd be really great to reach all of the GPs and nurses and other growing team across. That's really great. I think, I had another question here. It came through as well. Complementary therapies, how is it something that the patient can refer themselves into? We often get asked about it, or is it something that you would arrange for them or just signpost them to?
We can signpost I was going to say there's certain criteria. We've only recently re-established the complementary therapy at Kingsmill, so there's a lot of backlog. A lot of patients that are on the waiting list have been desperate to do it during the pandemic. So the criteria at the moment is they have to be either on treatment or within 6 months of having their last treatment. They ideally would like you to refer through us, and we have because it's ideally a written referral. Again, it's not ideal. She will accept emails, but she would prefer the full breakdown on a referral if necessary. But yeah, we're more than happy to refer on, and a lot of our services that run as well alongside us, like the Spring into Action, will signpost to complementary therapy as well. So we all sort of cross cover, and hopefully that way we can capture those patients that need help.
Fantastic. One of the things, again, coming back to communication a little bit, is when you asked whether any of the GPs had seen the care plans. Unfortunately, it was a resounding 100% no. So I'm not exactly sure where the lack of communication is there, but I think certainly any information of somebody that's taken that, that time to go through and really have a good chat with the patient would be very helpful. So it'd be really, really good to figure out what's happening there and actually get them into our notes, especially as say you work with our notes overall. So that's
Us as a service, we do a few of the holistic needs assessments, but we'll certainly, speak to the CNSs as well throughout the trust and make sure that they're actually being posted out to GPs. We can only really speak for Sherwood Forest, and I'm not sure what's happening with the EHNAs over at, say, City and Queens. So again, we'll ask the question, as to, what happens to them. Do they actually come out to you? In what format do they come out to you? So we'll do a little work around that. And I'm just wondering, James, because we've been sort of presenting, I think I've missed some of the chat, and I'm just wondering whether there's a possibility of actually sort of maybe sending us a copy of the chat. I don't know whether it's possible. So then we can sort of respond to each individual person, because I can see that Claire's said that she does a palliative support cafe over at Lammas Leisure Centre. Yes, I
have been answering them as you've been talking. I've not just been sat here.
Yeah. I just didn't want to.
I thought you might think that. I may have missed one or two up, but yeah.
Yeah, brilliant. Well, I mean, yeah, certainly collaboration offers of it have been coming in there, so that'd be really great. Actually, somebody's asked one thing, and a question I must say I'm not exactly sure. What does spring into action entail? I mean,
sorry, that was I was just a little bit rushed for time. I didn't want to. So spring into action, as Emily said, we've got activity workshops. So it's up to a 12-week course, depending on what's happening with COVID, because part of it is hydrotherapy as well. So recently it's been a 9-week, but they're expanding back up to 12 weeks to engage with the hydrotherapy pool as well. So each week they do a different topic, and then they do an activity session at the end to try and get people more active. So even if you're chair bound, in theory you can take part, because it's designed to get you up and spring into action. And then once you're more motivated, we've got the care, which is the ones that are run via the Mansfield football stadium, and that's a little bit more intensive activity plus a social gathering afterwards. So if you are in the recovery phase of your treatment, the idea is that we can get you moving again, and they will input onto our cancer information event as a prehabilitation as well, and we're working with the site-specific nurses to try and get it as a beyond diagnosis post-recovery as well. So it's each step of the pathway, hopefully there'll be a portion of activity built into that as well. So spring into action and care are working along that pathway to try and get your patient back up to normal, whatever that may be, beforehand.
Oh, that's brilliant.
We also have an occupational therapist who will help people get back to work, and so we can refer into the occupational therapist that will do some work rehabilitation as well, which is really good.
Sounds amazing. I mean, it sounds like a fantastic program to very holistic, very, lots and lots of different levels to help people out. And I think a really wonderful note to end on.
Well, actually, there's one final question in the chat.
Go, and
it'll take me 30 seconds. Someone's just asked how we cope with the day-to-day workload.
Great question.
So essentially, in a nutshell, it is a drop-in service. So we get people turn up at it's a pod basically, and come in, chat to us, ask for whatever support they're looking for, and we get phone calls, so patients asking for support or health professionals asking us to call patients. So it is just a case of dealing with what comes through the door basically. Some days it could be really busy, and some days it could be a little bit quieter, so you can catch up on some of the things that you've missed on the busy days. So it's just about kind of time management and just kind of juggling what comes at us, really. I think, do you two agree?
Yeah, very much so. I think I think that's the difficulty of not knowing what's coming through the door, because some days you could just have a series of people coming in and crying at you. Other days it's very much, oh, here's this booklet and hand it on. So it's very variable, but it keeps you on your toes, certainly.
We do keep a database of our activity, so obviously, if sort of post sort of recovery from COVID, if all of a sudden, we're a bit too rushed, then hopefully we'll have some information there to support an extension of the service.
That'd be really great. I mean, it sounds like you're already doing fantastic work, and it would be great to see what's possible with even more support and understanding from the community as well. Brilliant. I hopefully haven't missed any other questions. If I have missed anybody else's questions, please quickly pop it in the chat now. But thank you so much, Emily, Sue and Andrea. It's actually been a wonderful talk, and it's been really great to have you here speaking to us today. And I think I feel very privileged to have had your time this evening. And
I think we feel privileged to have had all of your time as well. So
very much so, yeah.
Thank you, everybody.
And we've obviously got the feedback form. Please fill it in. It's super important so we can bring you more events that you love and make them even better, and sort of go again, help support our service to bring you CPD and to bring you education and great talks like that we've had tonight. So please click on that link. I'll pop it again in the chat. No time like the present. Just give it a little click. It's a different link from earlier, and then we'll also be able to hopefully send you a certificate out a bit later. But it all remains me to say is thank you again to our wonderful panel, wonderful teachers today. Thank you everybody for coming. Have a lovely evening. Make sure that you get those referrals in. Make sure that you link people up with Macmillan, and we'll see you at another event really, really soon. So thank you so much for coming. Bye everybody.
Thank you.
thank you.
Bye bye.